The following content is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
You're listening to the Everyday Therapy Podcast. I'm JC Rader.
And I'm Julianne Schroeder.
And we're therapists bringing you honest conversations around emotional wellness and self-development.
Inspired by our personal experiences in therapy and because of our clients, we realize therapy has so much to offer both on and off the couch. Listen for tips and tools to navigate all the challenges that life throws your way.
To give us feedback on topics and guests, or for more information on our community events, counseling, or online services, contact us at everydaytherapypodcast.com. Hello, let's get right to our supporters. So, Lifeologie Institute is a group private practice here in the heart of Dallas with so many different counselors of different expertise, different price ranges. They start at $35 and go on up from there. And they are just a great group. If you've ever thought about seeking counseling or want to get back into counseling, working on personal growth or anxiety, depression, anything going on mental health wise, this is a great resource for you. I have trained there and they have just been so helpful for so many people in my life. So I am excited to share them with you guys and for them to be a part of our podcast. And they are at wefixbrains.com, and that's creative solutions for stuck problems. Love their motto because it's so true. They are creative.
Yes, they're out-of-the-box thinkers for sure. And with that, they have created the Lifeologie Institute for Psychotherapeutic Yoga. LISPY for short, which is a really cool training program for mental health professionals, yoga teachers, and anybody else, yes, who is interested in looking at the mind-body connection and creating change for mental health and well-being in that way through becoming a psychotherapeutic yoga clinician. So they are starting a new round of training beginning in June. And, you know, I'm on staff actually, and JC has graduated from the program.
Yes. Yeah. So we're huge supporters of them because the body does keep the score, like Peter Levine says. And there's always different ways to work through emotional issues, mental health issues. And we advocate for this one. So yes, thank you for supporting us, LISPY and Lifeologie. And let's jump right into our topic today, maternal mental health. So even if you haven't experienced having a baby, Julianne and I have not, but you probably know someone who has or may someday want to have that experience as well. So definitely listen to this episode. So we have Dr. Elizabeth Hatchuel on the line. Hello.
Hello. Thank you so much for having me. This is so exciting.
I know. We're so excited to have you. So I met you through the American Counseling Association conference, and you spoke about maternal mental health. And I was like, oh my gosh, I have so many friends who have gone through this, and I want to share it with other people, even if they haven't had babies. Like, they need to understand what's going on with half of our population with women.
Absolutely.
Yeah, it was so fascinating and interesting. And so I'm so excited to jump into this topic today. Could you just share, I know you are a professor at Capella University, and then you also have a private practice. Can you share just a little bit about your background before we get into talking about mental health?
Sure. So I live in Virginia, right outside of Washington, D.C. And so I'm a licensed professional counselor in Virginia, and I have a small private practice in Old Town, like you said, where I specialize in maternal mental health and the treatment of postpartum depression, postpartum anxiety. And in addition to that, I'm a core faculty at Capella University School of Social and Behavioral Sciences in their graduate program, School of Counseling. So I kind of have my foot in both areas. And so ACA was fantastic because it was an opportunity to connect with, the academic and the practicing community. And I got to meet people that I normally wouldn't get to. And I'm so glad that you found the topic interesting, because one of the things I found in attending that conference is there wasn't a tremendous amount of information or presentations on maternal mental health. So I think there's such a need, and I'm so glad that people are starting to kind of pay attention to it in a different way.
Absolutely. Absolutely. I guess just jumping into it, how do you get started in talking about this maternal mental health? What is it? What does it look like?
Wow. Okay. Huge question. So, right. Would it help to tell how I kind of got into this area?
Yes,
Okay,
we love
so let's
personal
start there.
Stories. Yes.
I love stories too. Okay. So,
relatable.
Before specializing in this and getting additional training, I had started my private practice. I'd been licensed, I think maybe for like 5 or 6 years doing community mental health. And I kind of broke out on my own, and I found myself specializing in mood and anxiety disorders. And my practice was pretty small, but it was mostly women, right? And at that point, probably in like mid to late 20s. And what I found when I was working with them is they all started getting into the childbearing ages, right? And so some of the issues, some of the anxiety and the depression started to look a little different, right? And we were talking about not only just, postpartum stuff, but infertility challenges, miscarriage, loss, all sorts of things. And I was like, I definitely need more training in this. It just felt different after doing this for many years. And that also paralleled when I became a mother, interestingly. And so I think maybe what you find in talking to other clinicians is that our professional interests very often mirror our personal experiences in some capacity. And so
Absolutely.
It felt very, is that still real to you guys too? Okay.
Yes.
So it felt very organic and natural to kind of turn my attention in that area. And it just really became a passion of mine, because being able to support women and in turn kind of understanding my own experience better was kind of just an amazing benefit to it as well. But the more that I learned that I still need to learn. But it's a combination of like the need presented itself, and I recognized I needed more training. And then I also just kind of selfishly wanted to understand what was happening, because becoming a mom is hard.
Yes.
So hard.
What does, you're talking to some newbies here, what does make it so hard for people?
Oh man. Okay. Any mama listening to this. So the experience is so different. So maybe it's not fair to kind of say that it's hard for everybody, but I think one of the things I hear in practice a lot is that it's not what people expect. And so again, I can kind of use myself as an example. I'm a clinician. I knew about postpartum depression, postpartum anxiety. I was super jazzed to become a parent. And then I became a mom, and I was like, this is not what I expected at all. I was exhausted. I never realized how much sleep deprivation was going to impact who I was as a person. And I felt like a different person, and not just in this is a different role kind of way. I just felt like I was interacting in the world differently. And I was doing it before a lot of my friends had children. So I felt like I was navigating it without a lot of guidance, or maybe I just didn't know where to look is a better way to put it. But it's hard for any number of reasons. And we can kind of talk about that later. There's a lot of things that make motherhood hard. But I think that a lot of people, one of the reasons I love this work so much is that a lot of people don't talk about how hard it is. And so I'm like super into dropping the veil and normalizing like that this is hard. So I don't even know if that answers your question. It's like such a wide open thing.
I love that. Yeah. And one of the questions that we had was, like you said, well, maybe it's not hard for everyone. I've never met a mother that wasn't like, this is so easy. This is not hard. Is that true? I mean, is it just
ladies,
hard
if you're out there, like, hit me up after this, because I have not met the woman who said that this was easy yet. But I don't like to assume for everybody that the experience is the same. And granted, the people who come into my office are certainly looking for specific support. But I have found that just even being out with friends or acquaintances or walking in the neighborhood and me just throwing out there like, yeah, are you okay? This is really hard. And if you're not okay, it's okay. And then finding out later that people follow up and thank you for saying that it's not, this isn't the best time of my life and that I should enjoy every minute. Like those words are meant to be so supportive, but they can be so toxic. things we don't think about.
Yeah, absolutely. I mean, because we think about women in general and the expectations that, in a lot of roles that we should manage. And so as a mom, like just accepting that, like, oh, this is part of it. But that creates a lot of pressure and a lot of shame then if you can't talk about it.
It creates a lot of pressure and a lot of shame. And I don't know what things are like where you guys are, but I live right outside of Washington, D.C. And so we have a lot of very career-oriented, educated women who are used to kind of kicking butt in every aspect of their life. And then they have babies and they kind of bring that same perfectionist, go-get-em mentality to it, which is amazing. But with that also creates its own risk factor because it's pretty hard to be perfect at something that is impossible.
Yeah. No, I can imagine when I get to that point, I will struggle with that.
Julianne's a recovering perfectionist.
Oh, you're recovering that. Recognition is the first step.
Right. Yeah, no, I think I've come a long ways. But yeah, I think you really speak to like, an element of parenthood in general. And I think especially for moms of being able to know you can do so much and there's going to be a lot of that's out of your control, but doesn't mean anything about you.
It seems
it's not right. It's not a defining characteristic of who you are, that it's natural, that it is hard, and it's okay to ask for help because, again, there's nobody who has done this, I think, without some element of struggle, whatever the struggle may be. Even if it's not full-blown postpartum depression or anxiety, like there's still the baby blues, there's the role adjustment, the identity transformation. Like there's so many elements of it to tackle, and you don't have to be severely mentally ill for that to happen.
Yeah. No, you make a great point, and we love that. Can you really dive into separating what baby blues is versus postpartum depression and postpartum anxiety and like what that would look like for somebody?
Sure. So everybody has heard of the baby blues, right? It's kind of this period after you have a baby where it's the first 2 to 3 weeks, right? Where it's kind of you're riding this hormonally driven roller coaster. You might go 1 minute from being like, this is the most beautiful and amazing moment of my life, to being like, who am I? What am I? I haven't showered for 3 days and uncontrollably crying, maybe knowing why, maybe not, but it's real intense. And it can catch a lot of people off guard because it's not necessarily how they're accustomed to functioning. Some people anticipate it. I think it's the kind of thing that there's a spectrum, right? Some people experience it in a very mild way. Some people less so. I think one of the things that's complicated about the baby blues is that it often gets, many of the postpartum issues get clumped into or written off as baby blues when it might actually be something else. Okay. Right.
Yeah. So time-wise, though, so people listening, knowing that after 3 weeks, if the baby blues persists, it goes into something else.
It goes into something else. And 3 weeks would be the max. I mean, the general kind of benchmark we're looking at is 2 weeks.
Okay.
Maybe for some women it's 3, but 2 to 3 weeks. And so when we start getting into something more so that will typically, if it's baby blues, it'll abate because after the baby's born, there's this hormonal surge because for women all women are lactating, whether or not they choose to breast or bottle feed. And so after those hormones start to settle down, and that process takes a while, but that intense period is the first 2 weeks. For many women, that just abates. And up to, they think 60 to 80% of women experience the baby blues. So it's very, very natural.
Wow. Okay.
So, right. So it's more. And we can tell sometimes if it's more right off the bat, because let's start with postpartum depression, right? It is the classic thing that, actually, let me ask you guys, when you hear of postpartum depression, what do you think of? Based on the media or what you know?
Yes. Yeah. I think of the stories that you hear of women wanting to hurt their children, kind of the extreme version.
Oh, postpartum psychosis?
Yeah. Yeah. And then, from my personal experience of knowing women who have gone through it, I know it's not that, but I don't know. That's what I think of from the media. What about Julian?
Yeah.
Yeah, I mean, I guess just more from personal knowledge, just that more depressed symptoms, isolating, and just, a lot of questioning, why am I not happy, and difficulties just doing daily life. Right. And then, I guess that's my picture of that.
No, and you're both right in that, JC, that the media really kind of lumps all of these postpartum things together. So you end up seeing these very sensational stories of women hurting their children. This is kind of trigger alert for anybody, but women that are hurting their children or and that's kind of classified as postpartum depression. It's not. Mm-hmm. It's not. it is, you see all of the classic, not all, but you see some of the classic depressive symptoms, right? Kind of isolation, depressed mood, very tearful, anxiety, agitation, sleep disruption, changes in appetite, thoughts of death, dying, suicidal ideation, passive or active. Those are all of a range. Sometimes there's disconnection from the baby and sometimes there's not, right? I think that's another thing that we see very often is that everybody assumes if you're depressed that you don't love your baby or you're not connected to your baby. And very often what's more happening is that women feel like terrible mothers and that their baby doesn't deserve them. They love their baby so much that they would do anything to protect their child from themselves.
Wow.
So
that's
it's
a lot to take on.
It is, right. And all of this is happening at the same time that they have become mothers. So those experiences are linked together, even though so you can draw and create meaning out of something that's not really real, right? So one of the things that differentiates postpartum depression from a typical depression is very agitated. So you're likely to see people that are really angry and irritable, and that might actually be the presenting symptom more than somebody saying, I'm so depressed I can't get out of bed. And that was something that was really interesting for me when I went through the training. And that really resonated with me in my postpartum experience because I loved my baby and she was beautiful and perfect, but man, was I angry. I was angry that my husband got to go to work and talk to grownups. I was angry that I didn't see anybody during the day. I was angry that I couldn't do the things I used to do. I couldn't exercise to help my own, go out my own stuff. Like I couldn't do the things and I was angry. And so that is a symptom that we see a lot. It's an agitated depression. That can onset right after the baby's born, and it can go up to traditionally we say a year, but some people advocate for a diagnosis of postpartum depression up to 2 years after you have a baby.
Okay. Yeah, I was curious about that too. Like how long does it last afterwards, or can it last up to?
So a lot of times if women come in and they're like, I've had a bunch of women recently, actually over the past 3 to 6 months, I guess, that come in maybe like 12, 13, 14 months postpartum, and maybe they just weaned, right? Or something just happened and it was like kind of a triggering event for those symptoms to kind of onset. And it's very disorienting because they're like, I've been fine. That is still considered a postpartum onset.
Wow, that's super helpful. I feel like our listeners to hear that, to know that it can happen, because I have just assumed it happens like within, like not being able to sleep or do the things you normally do.
And for some women, it's like that, right? And then there might also be a triggering event, like maybe return to work, right? And so all of a sudden there's a stressful experience on top of that other transition that just makes, the coping skills are no longer there, or there's some sort of biochemical adjustment that's happening with hormones because we do not really know exactly why this happens. That's the other piece. Like a woman can have postpartum depression with baby 1 and not have it again until baby 4.
Really?
Mm-hmm.
Wow.
So
interesting.
Different. Yeah.
Yeah. How about like genetic influence as far as like family, like playing into that?
So, okay, it's a complicated question. So what I would say, and it shouldn't be, but it is, because we know that risk factors for postpartum depression and postpartum anxiety, which I will circle back and define for you guys,
for sure,
is a pre-existing experience with depression, anxiety, bipolar, severe mental illness, and very often those are genetic. And so it might be that somebody is completely aware that, yes, I have a genetic predisposition towards anxiety or depression, so this is something I should be looking for. Some women have an onset before the baby's born. So during their pregnancy, you can also have an onset. So if you have all of a sudden a depressive onset during pregnancy, you are at higher risk for postpartum as well.
Okay, that makes sense.
Yeah. So there is, I guess, a potential genetic predisposition, but it's definitely not causal. It's just correlational in terms of what we know.
Okay.
Yeah. Okay. So I feel like postpartum anxiety, that's a more recent term that I've been hearing. Like definitely postpartum depression is used more often. Do you find that in your practice?
Absolutely.
Okay.
Absolutely. I think women come in all the time and they're like, my partner thinks, or my friend or my doctor thinks I have postpartum depression, and their primary presenting symptom is anxiety. And so, and that's interestingly, so what we think is that 1 in 7, the estimates range, but it's like 1 in 7 women might meet the diagnostic criteria for postpartum depression. And these are the women that are reporting the symptoms. So I actually think the statistics are probably higher.
Sure.
Postpartum anxiety, I just read a research study where they think it might be higher. It might be 1 in 5, because becoming anxious after becoming a mother is pretty natural, but like that crossover into, what is clinically significant, there's some wiggle room there. So postpartum anxiety, there's postpartum anxiety, there's postpartum OCD, which is kind of a subset. You hear less about it, but with the anxiety, you get all of the classic anxiety symptoms, right? So the physical symptoms, the cognitive symptoms, and the emotional. So, and I'm all over the place in how I'm describing this, but the physical symptoms of anxiety are generally pretty, like, anxiety is an experience that most people feel very acutely, right? It ranges from, clenched muscles, racing heart, problems breathing, headaches, muscle tension, all of those pieces. Cognitively, a lot of intrusive thinking. That is very classic with postpartum anxiety, and scary intrusive thoughts, right? Again, here's when we get into the shame and the stigma that women do not want to disclose scary thoughts about their baby, because they think if they tell me this, that I'm going to call CPS and have their child taken away.
I bet you have to be really proactive in talking to your clients and explaining, this is normal. Please share this with me. Let's talk about it.
I have a whole expanded informed consent about that. So when you talk about, I have a responsibility to keep you safe and keep others safe. I'm a mandatory reporter of abuse. However, I want to really be clear here that having scary thoughts is very different from having a desire to hurt your child or hurt somebody else, right? Because the fact that clients identify them as intrusive, that is good. Because if they don't identify those intrusive, scary thoughts as concerning, then we're kind of looking potentially at postpartum psychosis, right? And so one of the ways I explain that to women is I say, this is ego dystonic, which is a clinical term, but what that means is this is out of character with how you would normally view this situation, right? The fact that you are able to sit here and tell me, I love my baby. This is the most terrifying, disturbing thought I could imagine. I'm a monster. I must be crazy. The fact that you see that, that's good. I know it sounds weird that I'm telling you that's good, but like that means that this is not a psychotic piece. You are not crazy. This is your brain activating in a different way, and we can help you work through this. And so I try to normalize just from the beginning that it's, because it takes a lot of women a long time before they'll actually say what that thought is. But just normalizing that, it's really scary for them. And I think one of the things as clinicians that we need to do is normalize that there's a difference between a thought and a desire to act. And that's really hard, I think, for even some clinicians that are not trained in maternal mental health to understand, because you hear some of these things and it can be quite activating. And it's very normal, and it's normal within a postpartum anxiety framework.
Can you share some of the thoughts that your clients have opened up to you about?
Sure. And I mean, for anybody out there who is listening, who does experience postpartum anxiety, this could be potentially triggering for some people, because women with postpartum anxiety are very often easily triggered. So I've kind of heard the gamut. So some thoughts might be, I'm afraid I'm going to fall. When walking down the stairs and the baby's going to fall out of my arms and die, right? I'm afraid that if I put the baby on the changing table, she will roll out the window. I'm afraid, there's a knife in my kitchen. What keeps me from hurting my husband or my child? Some people have had sexually intrusive thoughts, which tend to be highly disturbing for them. There's any number of things, but I think at the core, it's what keeps me from doing this? Being familiar with OCD, there's that intrusiveness to it, that it can kind of come out of nowhere. And so again, there's so many, what am I trying to say? So generally when people get anxious, the thing that's intrusive is the thing that they're most afraid of, right? Harm coming to their child. And so that it's not the only piece of intrusive thinking, but it's usually, in my experience, surrounding the kids. And I also want to say, just because you have postpartum anxiety, you don't always have intrusive thoughts. Postpartum anxiety can also just be I lay down to go to sleep and my brain won't turn off. My brain's racing, and it's not about anything specific. A lot of catastrophizing and kind of rabbit hole thinking. And so it's not always intrusive, but I always like to normalize. I ask, are you having any thoughts that are scaring you? And that's kind of how I introduce it.
Okay. Yeah, it's super helpful. And I think like you're talking about everything that somebody, or a lot of things that somebody could come in with, and it could look, postpartum anxiety or depression could look like. And that's super helpful for our listeners to hear so that they could maybe see it in somebody else or themselves. But yeah, it can look it's so individual and can look so different for everyone.
It can be so different. And I think another piece to remember is that depression and anxiety go hand in hand. Like a very almost, and it's in the diagnostic criteria, right? Like if you have depression, very often anxiety is another symptom. If you have anxiety, depression can be another symptom. And for me, it's just which one rises to the top, right? You can have both, but one of them typically rises to the top. And that is what I try to identify in therapy and try to pursue first, because it's very often what they want the most relief from.
Absolutely. And I'm curious, is there anything else that would be helpful for our listeners to know about postpartum mental health before we get into like what's helpful and how you work with clients?
So, yes, I feel like you have 3 or 4 more hours. I think there's so many things.
Right. I know.
Right?
This Clip Notes version.
I know. So the one thing I do want to mention postpartum psychosis briefly, just because that is something that, so postpartum psychosis occurs in like 0.1% of new moms. Like it's very, very rare, but when it does occur, it is potentially lethal. And so it's easier to identify often just because a person is not oriented. So they're not it's nonsensical. They might be having intrusive thoughts and vocalizing them to the people around them, and they don't realize that there's anything wrong with it, right? People can also hide their psychosis, right? That's the thing. Some people can be psychotic in a psychotic episode and not, and actually hide it very well. It's really fascinating. However, very often this onsets within the first week or 2, and it's highly linked to sleep deprivation. So if women are, and if you have a family history of bipolar disorder, birth can trigger your first manic episode. So, right? But if you don't know, you don't know. This is where knowing your family history becomes important, and why I always encourage people to engage their family in that open dialogue, because knowing your risk can impact the way that you intervene with it. But if anybody ever sees a new mom who is not making sense, and not just an I'm tired kind of way, like that is somebody who needs assistance immediately, like medical intervention, possible hospitalization. And again, these are all things that women can recover from. And the beautiful thing about postpartum distress of any kind is that it has a higher recovery rate than what we see in traditional mood and anxiety disorders. So with intervention, most women, I know, it's one of the reasons I love specializing in this. I'm like, oh, you're coming in and you're going to get better.
You're getting better. I'm doing good work.
I'm doing it. No, and I mean, they're doing the work. It's more just about creating the space where it's okay to talk about this, which I think is so much a therapy, but working with new moms in particular, like you have to create that safe space for them to say all these things that are so scary.
Absolutely.
I would imagine, you have to really work through the shame and the guilt.
Oh, yeah.
That is really
Yeah. So did I answer that question? I hope so.
Yes, yeah. No, I'm just curious how, like, what is helpful for your clients? Like, what are the things?
Like on a practical level.
Yeah.
Practical level for clients.
All the way from baby blues to, through the depression, anxiety, whatever you're seeing.
So the first thing it is kind of identifying what the severity is. And so that's my job as a clinician, right? Because that guides what might be most helpful. So I think that for me, education is a huge piece of this. Are you guys still there?
Yes.
You froze for a minute. Okay, there you are.
I feel like for me, knowledge is power. Julianne knows this about me. I will go out and buy 50 different books about parenting whenever I go through that. Maternal mental health or all the things. So definitely understanding your process.
Yeah, and I think that it's so typical to hear, but it's so sad because people come in and they're just like, am I crazy? I'm like, no, no, you're not crazy because this is hard and because you're struggling and because you don't know exactly what's happening. My job here is to help you to understand what's happening so that we can develop a pathway through it. So for me, foundationally, it starts with helping people to understand what's going on. And there are a ton of resources for that as well, which I can highlight later. But so let's say that somebody comes in, it's highly variable. I don't want to overtax somebody, particularly when they're already stretched to the limit, right? And so what I like to really emphasize is that small things add up. So if they're struggling to, if they feel like they're drowning and they're not getting enough support, we might start with, okay, we need to identify some very specific things that you can get support with, right? And then we might spend time in the office looking what those is. Do you need more help at night because you're feeding the baby and you're getting up every 30 minutes? Like, does your partner need to step in? If you don't have a partner, do you have a family member or friend that can step in? I find that women asking for help is a huge barrier. Huge barrier. People do not seem to want to ask for help because it's seen as weakness. And that taps into all sorts of other things, because becoming a mother stirs up one's own family of origin stuff, positive or negative.
There's just so much going on right now.
So much. I don't even know how to narrow down this question, right? Because it's like
family of origin, that's like a lifetime of work is being triggered. Yeah. But kind of like right away, it seems like the practical steps and like getting over the hump of asking for help. Easier said than done, but working with somebody.
Working with that, right? And that's, you were at ACA, and that's one of the places that I use the DBT skill work on interpersonal effectiveness, right? Like, what are and that might not be in the first session, right? But it's like, what are the challenges to asking for help, and how do we kind of work through those? On a practical level, one of my first interventions is trying to understand the sleep and trying to stabilize the sleep. Because what experts recommend is that new moms get a cumulative 5 hours of sleep in a row. And that, everybody laughs at me when I say that. I'm like, no, I get it. Like, I was there. I remember cluster feeding in the middle of the night. Like, 5 hours is a dream. It does not happen. So, but if somebody is hovering on the edge of a major depressive episode, I'm going to say, yes, I understand. Like, fed is best though. Like, and then that tags into a woman's position on breastfeeding and whether or not she's willing to pull back on that for her own mental health. And again, like, I am an advocate for breastfeeding moms. I'm an advocate for bottle fed moms. I'm an advocate for healthy and stable moms, because fed is best. And so I want women to do what's going to be best for them and in turn their babies, because I think women fall on the sword all the time to breastfeed at everybody at their own detriment.
Yes.
So,
did you see Hillary Duff, her new post?
Oh, yeah.
On Instagram? Yeah. It was basically, she was like, I breastfed for 6 months and I'm a working mom and I'm stopping breastfeeding, and there's no shame with that. I'm owning it and encouraging everybody to do what you want to do, what's best for you. I feel like is that fed best? Is that like a hashtag? I feel like it should be.
It probably, fed is best. So Karen Kleiman is the one who I first heard that she wrote an article. So Karen Kleiman runs the Postpartum Stress Center in Pennsylvania, and that's where I did my postpartum training. And she has a slew of fantastic books that I recommend. But one of the articles that she wrote was called Breast is Best Until It's Not. And it kind of talks about the emotional spin-off with why stopping might actually be better if your goal is taking care of your baby, then like maybe actually getting more sleep and attending to yourself might be more beneficial. And again, like mamas out there, like I am an advocate for breastfeeding, but like I more than anything am an advocate for women just treating themselves with kindness in this process as well, because I think one of the things I see tremendously is women get lost in this childbirth experience. We live in a culture which, loves babies, and that's fantastic. But we're really, you say, if you ask somebody, how are you doing? And they're like, oh, I'm okay, and they start to give you the inclination. They're not. A classic response, a supermarket response is, oh, but it's worth it, right? Okay, yeah, I guess it's worth it. I guess I should just stuff those feelings back down then. And so anytime I see women like Hillary Duff and people that have a public voice to kind of take some of the shame away from that, I'm like, yay. Chrissy Teigen's another one who does some great work on that front.
Okay.
Yeah.
Ziggy's nodding his head. He's aware. He's our technician wizard over there. I'm not expecting him to be aware of that.
think he's maybe just aware with Chrissy Teigen.
Oh, he likes
I don't know.
Chrissy Teigen.
No, she's very much an advocate for health.
Really?
Yeah, she's great.
Yeah,
she
I
did
like her
Ziggy.
cookbook.
Yeah. So she had a great post, and I don't know how old her second child is now, but she basically went public about her postpartum depression and anxiety, and she was basically like, "Moms, I have everything at my disposal. I have money, I have support, I have a cook, a trainer, a job security, all these things, and I have this." So, let's just cut the stigma and get right to the fact that this is hard and it's okay to get help. And I was like, preach. Thank you.
Yes.
Yeah.
Seriously, that's so amazing. Okay, yeah, what else? So the practical tips, sleeping, doing what's best for the baby, which is maybe it's breastfeeding, maybe it's formula.
Yeah, maybe it's not. Making sure that you have a support system around you. Okay, so making sure, and I think so this whole it takes a village mentality, we know from the research that culturally collectivist cultures have less prevalence of postpartum depression and anxiety because they have a village around them. And there's some cultures, for example, where mom does not lift a finger aside to care from that child for like the first 30 to 60 days after the baby's born. And here, we're going back to work. So I think if you have a village, use it. If you don't have a village, try to build it. And I know that is hard work. And as clinicians, that's part of where we kind of come in. We have to help people make those connections. So what that means is knowing what's available in your community, right? Knowing what professional support groups exist. Like for us, I live in Virginia, Postpartum Support Virginia. We have all these regional support groups that we have developed. So every week there's a support group at a local hospital run by a survivor of postpartum depression or anxiety. So that's an example of kind of like professional support, right? In addition to therapy.
Yeah, that makes sense.
But there's also mom groups. Postpartum Support International has online support groups, which are a bit more informal. I think that building your village is really important, and not being afraid to look at somebody and say, I need help, or this is hard, which becomes more complicated for people that feel isolated or don't feel like they have a village. Yeah. That's a different level of work.
Sure. And I'm wondering too about, kind of the complicating factors that you can relate back to like your own family and being able to ask for help is knowing that it's okay to ask for help later on too, as well. Yes. Right.
Absolutely. I still ask for help, and my kids are 6 and 10, right? They're certainly out of that infancy period, but being able as a mom through all of these different stages to know that, there is no expectation. Everybody walks around. One thing I see, everybody seems to walk around thinking that everybody else has it figured out. Mm-hmm. And maybe that extends beyond motherhood, but with the clients I work with in particular, there's a heavy investment of she looks wonderful, or she looks so happy, or her baby's not crying, she has it all figured out. Whereas in my head, I'm maybe the more invested somebody is in pulling that I've got it all together front out there, I'm more worried about the internal experience. So, I think it's all about perspective, but, really that's part of what I feel like I really want to do in my work is destigmatize and normalize the chaos that is motherhood. And that starts from the moment that baby is born, that this is hard, and asking people for help is important. And we normalize that also for our children, which is one of my buy-in points with clients sometimes.
I love that. Yes.
It's would you tell your child that not taking care of yourself is an important thing to do? And they're like, never. Mm-hmm. Well, your kid learns as much from what you do as what you say, and maybe more. So let's normalize that taking care of yourself is important and okay.
Yeah, I love that. I feel like it gives people permission and also encouragement to ask for help versus, just hear, you need to maybe sometimes ask for help, but what's the buy-in?
Right.
So, yeah.
I also find that I saw clients this morning, and I don't know, it was one of those conversations you're having as you're settling into the room, and she made some comment about I couldn't find anything to wear. And I very casually just said, oh yeah, all my clothes are in a huge pile stuffed into my closet so I don't have to see them. And I just said it, and she's like, thank you for normalizing that. And I was like, that is my normal. I was like, my pleasure. And she goes, no, but you're my therapist and I feel like maybe you have it all together. And I said, I think everybody is managing their own chaos at any point in time. And I'm happy to be the person who breaks down that barrier. But like, to that point, like maybe there is a little more self-disclosure that happens in this area of work because in this piece, because people want to know that I understand that it's messy and that I have my own mess. That I don't make my mess theirs, but it's just kind of an example of something that might happen.
Absolutely. It's kind of the goal of our podcast is like, hey, we're human. We don't have it all figured out.
Right. And it's okay.
Yeah. Have you seen that Netflix show called Working Moms?
Yeah.
I feel like every mom needs that, like, especially like being in this Western culture of not having maybe family around you or too many friends, but I feel like that should be like you give birth, you leave the hospital, birthing center, where you're home, wherever, and you're inserted into a group, a mom's group.
I know. And I think that, so many people are like, why didn't anybody tell me it would be like this? And part of the answer is when you're pregnant, nobody wants to think that it's going to be that hard. And I don't say that with any judgment because I think I classify myself in that own boat as well. You just don't know. You don't know what you don't know until you experience it. But like being open to the chaos without as much rigidity, perhaps that's one of the movements we can make towards, normalizing this experience for everybody.
Oh, I'm realizing our time and how much more we could cover and talk about. But I want to make sure we get to some books and resources for people from that maternal mental health, just kind of keeping like normal, content, like typical, and then even people struggling with that postpartum depression, anxiety. What are some resources for people?
Okay. So the first resource I would recommend, and this is for clients and for professionals that might be listening to this, is Postpartum Support International. And JC, I think I mentioned this to you at ACA, but that is one of the places, it is like the clearinghouse of state information regarding postpartum support. So for example, you can go and there's a drop-down menu, and if you need to find support, there's online groups. There's education about what might be happening with you. And there's also, you can link to different states, and then you'll be linked to, if your state has a like postpartum support Virginia, it'll link specifically to your state little chapter. And from there, you can usually get specific referrals and recommendations for clinicians, for support group, for all sorts of things. So, and Postpartum Support International also does training on maternal mental health for any clinician that wants to learn more. So that is a great resource. The second, for those that are super into Instagram and social media, Motherhood Understood is a fantastic kind of new organization, but it's kind of like a clearinghouse. And then they have a wonderful social media presence. And on Instagram, they're great because they post stories from moms that are experiencing postpartum distress. And so it's kind of a hashtag speak the secret. So it's destigmatizing and normalizing. And they also do a lot of advocacy work on Capitol Hill. And so that is a fantastic place to look as well. I feel like I'm talking at you. So Karen Kleinman books are also wonderful.
Okay, yes, you mentioned her earlier. What are some of your favorites?
She has one that's called, I think it's The Postpartum Father. And it's almost like a bullet. These are all the things that your partner might be experiencing. And it's written almost like a bathroom book. It's like bullet points. But I think it's also wonderful for women because after I had a baby, like the idea of sitting down and reading a book was like, my brain wouldn't function that way, but I could read bullet points. So it's a really good resource for people that are trying to understand. And it also gives wonderful tips about what to say, what not to say, which could be its own podcast, I think.
Oh, yes.
What not to say.
Yes.
For anybody listening, what you say is, how can I help? What can I do? And if they say nothing, you say, okay, I'm going to bring dinner or I'm going to do your laundry.
Something specific.
Let's take off the load.
Yeah.
Wonderful. Well, we'll link all these resources and any more that you have.
Yeah.
Okay.
Maybe if you could send us some more and we can add those to our show notes and share on our social media as well.
Okay.
This was so amazing.
Yes. You're a wealth of information, isn't she?
Yeah. We could do like part 1, 2, 3, 4, 5.
I know.
Or just like
I'm sorry,
a whole
I feel like I
podcast.
talked at you guys for the past 45 minutes.
Well,
I'm
it's so
sorry.
helpful. Yes.
You know this stuff. That's why we're interviewing you.
Yeah.
Yes.
There's so much to cover. I'm like, where do we target? But anyway, it was wonderful being here. Thank you guys so much for having me.
Yes, I know that our moms are definitely going to be grateful to hear the words that you had to share today. So thank you.
Yeah, and thanks for sharing, your personal experience and kind of what goes on in your private practice and just, your knowledge and wisdom. So
you're welcome. Thank you.
Okay, we'll talk to you soon, Elizabeth.
All right, bye.
Thank you so much for listening to the Everyday Therapy Podcast. Don't forget to rate and review us on iTunes and share with your friends. It really helps us reach more people.
We might only record once a week, but we're with you every day.